Dr. Doris, welcome to our show.
It's
nice to have you here. Could you please introduce yourself to the viewers, because I don't know if I pronounce...
Oh, you did wonderfully. My name is Doris Grinspun, and I am the CEO, the Chief Executive Officer of the Registered Nurses Association of Ontario, which is the professional association representing registered nurses, nurse practitioners, and nursing students in Ontario.
Right. Okay. So today, really, what prompted this interview was the fact that I received an email from a newly grad, and her email, I'll be reading that to you shortly. And also, my background, I'm from Africa, and in my community, I'm actively involved. So there is this meet. Okay, before I talk about the meet, I noticed that a lot of Africans, when they migrate here, they choose nursing as their profession, as their career. And some of the reasons why they choose nurses could be that there are a lot of jobs that are available for them, and also the finances. I think the pay is good as well. So they all like going into nursing. But of recent, we're noticing that a lot of nurses who newly grad, to be precise, they're not getting that job that they think is out there, that is available for them. So what is your take on this? What do you think is going on?
Actually, we do not have enough registered nurses in the province. And the reality is that a large number, the large majority of new grads do get work in Ontario. So one will need to look more deeper on what's happening.
Right. There
was a time in Ontario many years ago that new grads wouldn't get work at all. It was about 70% of new grads that didn't get ever full-time work. And RNAO, the professional association, then approached government or convinced government to uptake a policy initiative on new grad guarantee full-time. And Ontario today is the only jurisdiction in Canada that commits to new graduates to find them work and find them full-time work. There is a registry in Health Force Ontario where they register once they graduate, and through that registry, employers look for their resumes, and it tries to match new graduates with the resumes. So I will need to know the specifics of what happened to our colleague and ensure that that's not the case. There is, in the last probably 2 years, a slight decline in the number of new graduates that are quickly finding work, and also that are quickly also transitioning to full-time work. So there is, but compared to other jurisdictions in Canada, we are certainly much better than other jurisdictions, yes.
Wow.
And then we will talk about some other aspects, which I will want to bring to you of, elements that I think nursing and society needs to look.
Right.
And to overcome some systemic barriers also.
Okay.
Yes.
Okay, good. So we were supposed to have a newly grad nurse on stage today, but for some reason she couldn't show because of the weather outside. However,
or maybe she found work.
Maybe.
Or maybe I should just using that as an excuse. Yes, that's the point.
I hope so that that's the case.
That's the point. However, we got this new email, and I'm going to read to you one of her concerns and what she said. When I read it, I was really disturbed. So I immediately picked up the phone and I said, you know what? I need to interview you on this, because if this is going on,
it's not good.
It's not good.
It's not really good for them, not good for patients.
Exactly. Hello, Joan. I graduated from York University and I got my registered nursing license July last year. I have been searching and applying for RNAO position for over a year now. and still have not found a nursing job. I have applied for jobs all over Ontario. I also applied with agencies but had no luck. Most RON job descriptions states must have at least 1 year paid or acute care RON experience. Most new grad programs either reject me or did not reply at all. It is frustrating to graduate with a bachelor degree in nursing and I cannot get an interview or a job. I am currently working as a caregiver for a home care agency, which doesn't really require a degree. The pay is nothing close to RON pay, and it feels very unsatisfying. Every time I tell people that I am a nurse and looking for a job, the response I get in my community is, "I told you so." The truth is, new nurses are graduating and struggling to find a job. That's our opinion. I want people to know how bad the situation is for us. Can you please let people know this through your show?
So my reaction is first to thank the person that wrote to you,
Right.
because it requires guts, courage, and authenticity to actually convey that after a year you haven't really found work, whether the profession you chose is nursing or whether it's another profession. So first of all that. I also would then ask her to connect with the professional association, to guide her. Because while from time to time I hear about situations like this,
So this is
it's
not the
the
first
exception.
time.
It's not, but it's the exception.
It's an exception.
And in those exceptions, we get very involved in supporting people. Because could be for a variety of reasons. Could be that she didn't register in Health Force Ontario. Could be that she is applying, she says she's applying everywhere, but maybe it's the way she wrote the letter. Maybe there are, like in any other profession, there are ways you can frame the work search and the resume and the work search. We do have a person at RNAO specifically dedicated to resume writing and interviewing skills. And that person is available for us to be able to help exactly in situations like the colleague that wrote to you, whether they are a new graduate, whether they are a new immigrant, or whether they are a person that lost the work or wants to change work. So I would really urge our colleague to connect with us and for us, and with me directly and with us to try to help.
So what I wanted to know that, like something like your facility, is it provided to these nurses at the schools, at the graduation? Because, for example, this person, I don't think if she knew about this, she would even be you know, maybe she doesn't even know it exists. How do they know about these things?
First of all, let's not assume that she has not done all that.
Yeah.
Maybe when you will write her, she will say, I already registered in Health Force Ontario. I already went to a career counselor that helped me look at the CV, and then we will need to find other ways to help her, right? Most schools do share with colleagues, with the students about RNAO. Some do, and some professors more than others. I'm not saying York University doesn't. It's in fact where I did my PhD, so I know the university very well. I know they have huge respect for RNAO in general. Okay? Say you missed the class where they spoke about Health Force Ontario, you missed the class where they spoke about RNAO. That then becomes also your own responsibility, right? To connect with the professional association, right? And say, where do I go to look? Or to connect with the prof, where do I go to look? Or to connect with colleagues, where. Now, it might be that she actually has done all of this and that she actually has looked for work. What aches me the most, if you had said to me that she has done interviews, but she was turned down, I could give you some other answers, including systemic barriers. If she is a person of a minority group, which aches me that in our profession, but as you know, in all professions, these things can happen.
Going on,
and we need to fight them,
right.
and we need to push them, and we
right.
need to tear the systemic barriers down, and we need to deal with them.
Right.
It aches me that she has not even been interviewed.
Right.
Right? How is that possible?
Right. Well,
and to say that they need to have a year of paid experience, the program that we have between the government of Ontario and Health Force Ontario that RNAO pushed on new grad guarantee is exactly because they cannot have a year experience before they have a year experience.
Exactly.
So it goes like this: you register, they match you. You need to be broad-based and not say, I only want to work in this sector, in this hospital, or in this nursing home. You know, you need to be open to the possibilities because not every organization needs new people. Right? They first need to give to the people there. That's because, especially if they're places that are unionized, they need to first give the opportunities to the nurses that want to move internally. But there is enough movement that it should not take a year, right? And the program is such that the government provides the healthcare facility, the hospital, let's say, 6 months of pay to have you as a new grad being mentored for 6 months. And working side by side with the nurse for 6 months. So the organization doesn't even need to spend the money, right? So I would very much encourage the colleague that wrote to you to connect with us to help her, but anyone that is listening, whether it's now parents or sisters or brothers or nurses that are listening to this, let me assure you, number one of one thing, there is no better profession.
Dan Nonsen.
There is no better profession.
I agree with you on
I
that.
have worked in 4 different countries, so I know about nursing. There is no better profession. There is tons of opportunities. In fact, it's a feast of opportunities, nursing, that you don't need to be in the same specialty for 20 years, that you can start and then say, you know what, I want to try now perhaps another unit, another specialty, or another sector. I want to move now to public health. I want to move to primary care. You can do that in nursing. Yes, there are, like other professions, but I would say way less challenges on finding employment. And the pay is, as you well said, very good.
It's very good. I guess my next question for you is, in all honesty, what is the state of nursing labor market currently?
Yes. I think, I mean, all in all, is a very positive labor market. I think that there are challenges in some places with replacing RNs with other professionals that are perhaps less prepared or cheaper, right? I think we think that that's not a move that is beneficial for patients. There is a very clear and direct link in the research between the number of hours of RN, registered nurse care, and the outcomes that patients have in a variety of aspects and recovery, right? So I think the issue with nursing is that it's a cycle, right? There are periods that are I call it the 7 good years, and then periods that are slower. But all in all, the cycle today is not nearly the tragedy of cycle that we had in the mid-late 90s, when it was a disaster in terms of our registered nurses not finding work and replacing RNs, etc. That's not to say that we as an organization are not continuing to push for more hours of registered nursing, not only because of the colleagues that complete programs, but also because patients need that. Right. So all in all, and then if I compare Ontario to other jurisdictions in Canada, there are many supportive programs in Ontario that other jurisdictions don't have. The new grad guarantee, which either is not working or our colleague didn't know, and that we need to continue to shape. The nursing education initiative, that nurses that already are working can go back to school and can get some funding back through this initiative for the school they do or for a institute or a conference that they go, etc. The advanced clinical fellowships for nurses that are already working for years and they want to renew one aspect, not go back to school because I don't have time to go back to school to 2 more years of a master or to 4 more years or 5 more years of a PhD, but I want to put more depth, let's say, in pain management. There is a program called Advanced Clinical Fellowships where we provide funding. Again, it's a partnership of RNAO and the Ministry of Health. We provide funding to the healthcare organization to actually free up that registered nurse for 12 weeks so that that nurse can get a mentor that is a nurse with master or PhD preparation on that topic and put more depth. And there is also for registered practical nurses.
I was going to ask that because you're specifically saying RN,
yes.
So I was going to ask about the other.
Our association represents and addresses the needs of registered nurses, RNs, nurse practitioners, NPs, and nursing students, baccalaureate prepared students.
Right.
The Registered Practical Nurses of Ontario does that activity for registered practical nurses.
So they don't have the same procedure with all of them, as in like everything that you have explained.
They also nursing education initiatives, so they also have the nursing graduate guarantee, but they focus on registered practical nurses. You know the difference between registered practical nurses study 2 years in a college,
and then
registered nurses is the baccalaureate education, and of course out of that comes the master and the PhD in nursing, which I need to tell you, we have more and more nurses that also are advancing those programs, including nurses that either do that right away after they finish the baccalaureate, soon after they go on, or nurses that after several years of practice decide, now I want to do a master's or a PhD, and opens different career opportunities.
Okay, so let's talk about those new immigrants or people who wants to go into the nursing profession. So what will the nursing job market looks like in 2020?
I think the labor market in 2020 will look very good, and I will tell you why. Because we are looking at health system transformation, which will continue to be a movement of trying to have people more and more served in their communities, which is good for people. People don't like to be laying in hospitals, but that will make hospitals more acute, right? Because the more sicker will be in the hospitals, and therefore they will need more registered nurses, not less in those hospitals, but also in the community. People will be coming through the recovery journey to the community, right? And you will require registered nurses and advanced practice nurses, which are those that require a master preparation, or nurse practitioners. Remember, in Ontario, we open now, and it's the only jurisdiction in North America. We open 26 nurse practitioner-led clinics, right? Those are registered nurses with additional education of a master's in primary care that are now serving the public as the primary care provider, right? Working in partnership with other professionals like doctors, nutritionists, etc. But they're the primary provider. We are moving to nurse practitioners now also in long-term care facilities. We are moving to RN, registered nurse prescribing in Ontario, prescribing certain medications. We are moving, we already moved with nurse practitioners that can admit, treat and discharge patients in the hospital sector. And many hospitals are using them. So, I mean, the future to me is very bright because, as I said, these are cycles, right? We are now on 214. Up to 220, there is a long time. We will be on this totally upswing, and then we will be saying, we don't want to get more people sick, but let me tell you why. Not only because we don't, but because the role of nurses, all of nurses, whether it's an RPN, registered nurse, nurse practitioner, or a PhD or master prepared nurse, doesn't matter which nurse, our preparation is first in keeping people healthy.
Healthy, okay.
Right?
But if they're not sick, then they're not coming.
It's about health promotion. No, there is a huge role for nurses in health promotion and disease prevention. All our public health nurses, all our nurses that work in primary care. It's about keeping us healthy, right? And then to patch you up, so to speak, as Tommy Douglas, the one that developed Medicare in Canada, patch you up when you're sick, right? And for that we need, you know, nurses also. So nurses have, as I said to you, a feast of opportunities. And for parents, don't ever listen to someone that says to you, I told you so, or to a new grad, I told you so. If your daughter's son, and yes, sons also, and husbands also,
Yes,
it's a
I've seen
fantastic profession for women and men, are a nurse or want to become a nurse, come on, because we need you, and if you don't find work upon graduation, we will take upon ourselves to help.
That's good. Very good. So my next question for you is, if all nurses or potential nurses are afraid of going down the career of nursing, thinking that there are no jobs for them, and people are not talking about it, and they don't have an opportunity to get the information that you're giving now, and then which I think it will result to shortage of nurses. And if this happens, what does that mean for me?
So let me clarify, and we're speaking very honestly and very openly here. No, there will not be a shortage of nurses because of applicants, because in reality we have way more applicants than what we can take. So that's not the case.
That's a relief.
That's not the case. Well, yes, it's a relief if we have politicians that don't only play politics, but actually that dedicate themselves to healthy public policy. And that's where the issue of the impact of RNs on outcomes is so important, right? And I am not saying the current minister is playing politics. I actually think the current minister, Dr. Eric Hoskins, understands the role of RNs. In fact, he asked his team that he wants us, RNAO, involved on anything that has to do with improving the situation and ensuring new grads, etc., get the work that they want and they are prepared to do. So I'm very hopeful on that front. But politicians cannot look only, and employers cannot look only at the dollars and cents of what we are paying today. Because if you do, then you all the time downgrade, downgrade, downgrade. And I'm not saying from RN to RPN only. I'm saying from RPN to unregulated worker, as right? This colleague unfortunately ended up doing, even though she has more preparation. And it's because we want to pay cheaper, right? But the reality is it costs more. Because if the patients do not receive the care they need, what you have is people get sicker and you have hospitals readmission. So they end up in a hospital, which is the most expensive sector of all. So that's one piece that is important. The other piece, and it's a piece that especially in your show, we absolutely need to take and we need to tackle together, is the issue of systemic discrimination. Okay? This is something that is not sufficiently discussed publicly, and is something that absolutely needs to be acknowledged, whether it's in nursing, in medicine, or in any other profession. You walk, please, to any hospital, and you will see amongst frontline nurses, whether those are RNs or RPNs, people, as I say, of all colors, all shapes, all everything, right? You move down the ladder and then start to look at managers, and you tell me if you see the same, if you see the same beautiful rainbow. And then you go to even higher positions of chief nurse executive or of CEO of a hospital, dare I say, right? Or of a minister, or of a positions like mine in organizations, and the rainbow becomes whiter and whiter and whiter and whiter. And we got to tackle it.
But what do you think is the cause? Is it that they're not qualified enough?
Systemic discrimination, as it has always been to a lesser degree, but still there.
From which level is it coming? Is it
society, powerful groups? Powerful groups. It's an issue that I go to meetings. I go to whether it's government meetings or nursing meetings or any meetings, right? And I look in the room, and I am many times a keynote speaker, and in the middle of the talk or at the end of the talk, I will just say, could please people of color, any color, I go, stand up, right? And you see a few. And I go, what's wrong in the picture?
Something is wrong.
Oh, yeah,
Something
definitely.
is wrong in the
Clearly,
picture.
yeah.
And unless we will discuss this openly and tackle it head on,
It won't be
we will
resolved.
continue to see that.
Right.
And I'm not saying that it's not fantastic to be a direct care provider and a staff nurse. That's the reason I'm in this position, is because I believe so much in direct care that I want to get to the nurses, to the registered nurses and NPs and etc., and to all nurses, including RPNs. The conditions to work and the opportunities so they can be the best they can be for the people of Ontario and for the people of the world, because we do a lot of work in other countries. But if people want to move, not because it's moving up, I don't like that term, it's because they want to experience other roles.
Right.
The most important role in nursing, as in medicine, is direct care. So to me, that's where the power of nursing is, and that's where the passion of nursing is, and that's where the most importance of nursing is. But if people want to experience, like anybody else, right? It's not possible that only people that are white want to experience these other roles, and that's why it happened.
Oh, yes.
What's going on that you don't see the same beautiful rainbows as you have different roles?
Yeah.
Absolutely, it needs to be tackled
It does.
directly and head on,
So
and discuss openly.
Right.
It's not okay.
Who can we speak to, because we want to get down to the bottom of this thing? Who do you suggest that we can get to, you know, bring to his attention, make him aware or her aware that, you know, why is this happening and this needs to be tackled, needs to be fixed?
You know what? I dare say Kathleen Wynne, the premier, not because, no, not because she wears the responsibility of changing this province, but because she has the genuineness and the values and the understanding of the importance of it. She has the courage to say that she is a lesbian person and a premier of top-notch priority.
Right.
She has dealt with adversity. She has dealt with what it feels to overcome challenges.
Right.
And I think if you were to bring her in and have a roundtable discussion,
yes.
a roundtable discussion with many of us,
Oh, yeah.
she will tackle it.
Yes.
She will tackle it because
look into
she
that.
has the values,
Right.
the courage,
Right.
and the honesty to take something like this and make it happen. And she has the power
Exactly.
now, as premier, to
Exactly.
actually
To
make it
change it.
happen.
Exactly.
Yeah.
So let's come back to the topic for our
Yes.
discussion. So I'm going to read you a survey that was conducted, and it says that according to this survey, 24% of managers said applicants don't have any relevant work experience, and 22% said they were only interested in applicants with specialized training. Among managers currently hiring nurses, 41% said they were only interested in experienced nurses, not new grad. How do you respond to this, and what do hiring managers want?
I have, first of all, one word for it, short-sighted, lack of leadership, lack of seeing the future. When I was doing my PhD, and all of my degrees up to then are in nursing, the undergraduate, the baccalaureate then, and then the master's, my PhD is in sociology. Okay. And it is in sociology because I wanted to look at the social construction of caring. How does it happen bottom up? How does it happen, including these issues that we just discussed, right? All the power issues and the relationships and the dynamics that nursing care happens to be the way it is, right? And one night, I was in the night shift with the nurses because it was participatory research.
Okay.
And there was this seasoned nurse, let's call her, very mature nurse, preparing medications. And then all of a sudden comes this new grad that had just started and asks a question. And then the seasoned nurse tells her the answer, And this younger nurse goes and does what she needed to do. And I asked the seasoned nurse, how does it feel? Right? How does it feel with these new grads, right? And she gave me the best answer that every one of those managers that you see in that survey should know. She said to me, it feels fantastic. I have the experience, they have the legs. I have the experience, they have the energy.
The energy.
I am the present and the past, they are the future. If we do not understand that comment that that wise seasoned nurse made to me that night, and we all don't understand how real it is and how important it is to build our own profession, let alone give the care that patients need now and in the future by mentoring the new grads, then we are short-sighted. That's why I started by that. Short-sighted. Now, it is absolutely uncalled for because this government in 2003 put a program, as I mentioned to you, the New Grad Guarantee, which gives the same employers, managers that are answering, 6 months of salary to pay that person to mentor for 6 months. So you got to
hire them and have training, and they're getting. So
right
then,
there.
what's their problem?
Well, I am going to look into that, but it's
You should, because
short-sightedness.
this email that I have here, the same issue, she says, I'm a new grad, I'm an RN from Brampton, I'm having challenges finding work, I have applied everywhere, I know with all the cutbacks these days. So are there's cutbacks these days because of?
The government has not increased the funding for hospitals, let's say, right, in a way that keep pace with salary increases, et cetera, et cetera, et cetera. And then they say to the employers, figure it out.
Right.
We can get into all that discussion if that's good, not good. There are many angles to that
Where the
comment, so
cutbacks
don't
are
take
coming.
it one way or another.
Yes.
Okay.
But then it's up to employers. How do they manage the budgets? And to do that on the backs of not hiring enough nurses or not replacing with some leave is short-sighted because patients will become sicker.
Exactly.
So they will have patients longer or they will discharge them not ready and they will come back.
Right back.
So, I mean, leadership is about having foresight. Leadership is about understanding what will sustain you, not only today, but well into the future. That's leadership. Otherwise, it's just, you know, doing
I
things,
love that, yeah.
right?
And even in anything, not
And
just
if
nursing.
anything, you learn from the past
Right.
to build that present and future. And you know what the past
I
is.
do
It's
know.
exactly what I said to you.
Exactly.
Then we will be saying, oh, we don't have enough nurses. As the previous government sent to me to the US, to Texas, bring nurses back home. I don't want to tell you how much money we spent in bringing nurses back home, and a handful already came. So let's prevent. And this government, both Premier Wynne and Minister Hoskins, understands that we can't afford the game. This game of, you know, let's
support them because there's a lot of students that are ready and they're vibrant to work.
And to be quite honest, I met today with Jim Wilson, who is now leader of the opposition, interim leader of the opposition, who was my Minister of Health when I started at RNAO. We had a great time and a great laugh today. And with Christine Elliott, who, as you know, is running for leadership in the PC party, and she's the health critic. And they do understand that today we cannot do these games with nursing anymore because nursing has become now a knowledge profession that understands fully that we have compassion and heart, but we also have heads and brains, and we provide quality care based on compassion and based on knowledge. And that if I don't find work here, I have my toolkit. My toolkit is here. This is my luggage.
Oh yeah.
I take and I go. And I will find work
somewhere else.
So governments and opposition parties, they all understand that nursing is a precious resource. That's why I'm optimistic about the future. But any nurse, any colleague, whether it's a new grad or not a new grad, that you hear please, 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 we will give you a stack of cards.
Definitely.
Send them to us because we will commit to find them the
Right.
work. I'm not saying that solves the problem.
Right.
We need to look at all the other problems and
That's
understand
Right.
through listening to them directly also.
Right.
What are
And
the
what
issues
they're
we need
not
to tackle?
doing
that we
or
need
what
to
needs
tackle.
to be
Yeah.
tackled.
So,
Right.
in just one sentence, what final advice or word do you have for new grads out there or people who are contemplating nursing career?
I say, first of all, make it a career of choice. If you are a parent or if you are a family member, it is a career of choice for men and women. It gives you a tremendous array of opportunities, both in this province, in other provinces around the world. Around the world, you are saying you are from Africa. I want to know which country in Africa, right? Because I mean, how much we need also nurses to do international work, hugely, right? Not just to take them away from us, but to send ours there, right? It is a career of choice. And I say, second, get involved deeply from day one in nursing school with the Registered Nurses Association with RNAO. We represent nursing students. And get involved with the NSO, the Nursing Student Organization, which is our interest group, is one of our experts groups where many of these issues are being tackled. We also have another one of our expert groups that is the International Nurses Interest Group that speak and have dealt with many of the issues we are talking in the past and likely today. And we are all part of a family that wants to do what's best for nurses and, even more important, what's best for the public we serve. And without having the nurses working full time, we cannot do what's best for the public and for communities. So we need you, and we need you engaged.
Yes. Thank you so very much for coming.
It's a pleasure.
Thank you.
An absolute pleasure.
Thank you.
Thank you so
A
much.
privilege. A privilege.
Well, we've come to the end of our discussion. My take on this is, for new grads, I encourage you to read more posts. Go to RNAO website and then spend minimum of 3 to 4 hours at the employment center. Consider agencies as well while still looking for that permanent position. There are jobs out there. You just need to be a little bit more patient and resourceful. Don't be discouraged. While you are looking for that earning power, be willing to start at a lower level. Then from there, you work your way up around it. Realize that you might not get the job that you want immediately because work is more decentralized today. Note that you need to be capable in a number of areas to be marketable. And for those of you who are contemplating nursing job, speak to career workers. Talk to a counselor, talk to people who are in the nursing profession already. Be different and think for yourself and not let others think for you. There are a lot of myths that are going on out there. Do not let any of that affect you. Success is something you make of it, not what others make it for you. So you have to be able to use your mind in whatever it is that you want to do. You can as well work towards getting knowledge and experience in multiple areas. My best wishes for you.